This is a See Jason podcast, and we're Alain Beaudry,
Thomas Ferguson,
and Paul Komenda.
And we're from the University of Manitoba in Winnipeg, Canada. We're here today to present our paper entitled Cost of Dialysis Therapy in Manitoba. Many patients who experience kidney failure will require life-saving therapy on dialysis. The economic impact of providing dialysis is substantial, with Canada spending approximately $2 billion to provide dialysis treatments every year. Dialysis can be performed through hemodialysis or peritoneal dialysis, either in hospital or at home, with different cost implications.
In our study, we aim to provide a contemporary description of the cost of dialysis for the public payer using data from a single center in Manitoba, Canada, that provides care for over 400 dialysis patients. We evaluated the cost for hemodialysis provided in hospital, dialysis provided at home with peritoneal dialysis, and hemodialysis provided in the home with conventional machines and the Next Stage System 1. In an effort to get at the true cost of providing these services, we went so far as to include items such as consumables, staff overtime, and even building depreciation. We found that a year of maintenance dialysis care was lowest among home peritoneal dialysis patients, costing approximately $38,600, and was slightly higher amongst patients who received dialysis at home with hemodialysis machines at $39,200 for conventional machines and $43,800 for the Next Stage System 1. In comparison, a year of maintenance therapy on in-center dialysis totaled approximately $64,200. Consumables tend to be the primary cost drivers for home dialysis modalities, while labor costs tend to be the primary drivers with in-center hemodialysis.
Training expenses were the highest for home hemodialysis, with conventional machines costing approximately $24,400 versus $16,100 for the Next Stage System 1, and were $7,200 for patients trained to perform peritoneal dialysis. As such, you would require a patient to remain on therapy without technique failure for at least 3.2 months with peritoneal dialysis, 9.7 months with home hemodialysis using Next Stage System 1, and 12.6 months with home hemodialysis using conventional machines, in order to reach cost neutrality versus in-hospital hemodialysis after accounting for additional training and home setup expenses. In summary, our findings suggest that home modalities continue to offer exceptional value for money in comparison to the in-hospital alternative and should be recommended in patients who are capable of self-care. Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.